Well, we've had our short break. Well, it was kind of a little longer short break than I've had usually, but you talked about both diabetes and sleep apnea having to do with general body health, and it would come into the dental area. What can be done, or what should be done, for those people who are the heavy snorers? That's what I have to call them, because there are more than I ever guessed.
Well, sleep apnea, first off, is an obstruction of the airway. And it can be a total obstruction where you stop breathing, and it's measured in how many times you stop breathing per hour and determined by a laboratory sleep study.
Okay.
And depending upon how many times per hour you stop breathing, determines whether you have mild, moderate, or severe sleep apnea.
What I'm always looking for, is there something that can be done early in life to correct sleep apnea or prevent it?
There are things that you can do. It starts young. It can start young. Between 2 and 4% of children have sleep apnea. Generally, in kids, it's tonsils and adenoids blocking the airway. So you get them removed. That will help. Then, a lot of cases, being overweight is the biggest factor.
It is?
It is. So, kids, if you get them slimming down, adults, if you're getting them slimmed down, that's going to help. Maybe it'll eliminate it as a factor. We don't know. But many times it does help if someone takes enough weight off.
Okay.
One of the risk factors is the lower jaw being underdeveloped. When the lower jaw is underdeveloped, that means the tongue is positioned further back, blocking the airway. So in children, with using orthodontic functional appliances, we can move the lower jaw forward to where it should be, and this may reduce the risk of their developing sleep apnea when they get older.
Hold it right there. That hits the nerve there, because I was going to ask you, is there something in, how did you say it, repositioning the jaw through the use of braces?
Not braces themselves, but special orthodontic appliances.
All right, some other appliance.
Right.
What would you use for something like that?
There are about 90 FDA-approved appliances that can be used as far as sleep apnea goes.
Yeah.
But in youngsters, we have some appliances that do a similar job. They're made slightly different, but very similar, and you use them to make a permanent repositioning of the jaw. In adults, when you're treating sleep apnea, it's a temporary overnight situation where you are moving the lower jaw forward to open up the airway, just at nighttime. So those individuals, then you want to reposition the jaw back to whatever their normal position is, whether it's good or not, so that the teeth come together properly.
Well, I guess I'm thinking from the time you're born until you get grown up, your jaw is constantly moving, not and I don't mean for talking or eating, but it's part of your body growth.
You get growth in the back of both the upper and the lower jaw, moving them forward as the face develops, and the whole face really develops about the way the jaws develop.
Well, that's what I'm wondering.
And this, is largely completed by about the age of 12. You get small amounts of growth after that, but the vast majority of it is by age 12. And this is why in most cases we don't like to wait until the youngsters are 12 to put braces on them. You want to do something earlier and take into those growth factors.
All right, I'm reading into what you're saying, because how early can you start such repositioning of that jaw?
You can start repositioning. I like to wait until the 6-year molars are in, so about age 6. But You know, if children have small, narrow arches, even though the lower jaw may be where it's supposed to be, but if they're still small, you can do things to make the arches bigger, and they're starting that at age 3 or 4.
That sounds good.
And today, too many youngsters, infants, are not breastfed, they're bottle fed. That keeps the jaws from developing properly. The jaws of babies that are breastfed develop much better, and they have fewer problems when they get older.
That also makes sense.
This is entirely different than what we've been hearing in the past about how it helps to develop the immune system better.
Well, I've always heard that they say the mother's milk is the only thing that the child should have at the start, but if somebody cannot produce the milk, they have to use a bottle. So if a child could not be breastfed and has to be on a bottle with a formula, is there something that could be added to that formula it won't make up for not being mother's milk, but is there something that could be added to a formula that would take care of it partially?
There's nothing that I'm aware of, but going back to the arch development, they are working on pacifiers that will help to develop the arches better.
Gives the exercise, the sucking action.
Yes, and I'm not sure exactly what they're doing with it. I haven't heard too much on it, but there has been a pacifier that was developed probably 40, 50 years ago that was supposed to help this, but it doesn't. They don't have anything on the market currently that does help to...
In other words, you can't replace the mother.
That's right.
May sound weird in one way, but yeah, it is true because it's natural movement anyhow.
Right.
But maybe someday a little bit more research will turn up something.
Yeah, they're working on it all the time.
This program is sponsored in part by